Instagram Live, actually, that
Oh,
I've ever done.
this is very exciting. Yes. Well, I'm very excited to have you, and I think our audience is really excited to get this conversation started. So, let me begin by introducing myself. I am Dr. Lauren, for those of you who don't know me, and I would love to introduce my guest today. So, this is Dr. Nicole Katz, and she is a neuropsychologist based out of New York State, and you're in Manhattan, correct?
I am. I'm in Manhattan.
Yes, and you specialize in doing neuropsychological evaluations for children from 4 to 26. Is that correct?
Yes, that is,
Yes,
yes. I
yes,
say
and
up to 26 because really my niche is the academics and kind of school supports. And so at times you'll see, at the age of 26, they're still kind of going into graduate school and
right,
needing supports in that realm.
absolutely. And I know that you vary between, well, it's a wide range of the learning differences that you can diagnose and, set up for accommodations. So I would love to kind of delve into some of these questions because I know that I've been promoting this conversation. A lot of people have seen the questions, so I know they're very excited to hear from you. Um, okay, so usually what I do is I outline the four questions, and then I'll begin with the first one so everyone kind of knows where we're going. So the first one
Perfect.
obviously is, who do you typically see, and what does your job entail? How often do you diagnose students with dyslexia, and what kind of supports do you recommend? Can you tell us more about your practice in Manhattan? And then if you could maybe give our audience 3 to 5 signs that parents may need to seek a pediatric neuropsychologist. So let's get started, Dr. Katz. So can you
Yes.
tell us a little bit about, what your job entails and who you typically see?
Yeah, absolutely. So a neuropsychologist is technically a psychologist, so a fancy name for a thoughts and feelings doctor that has special training in how the brain works and how it impacts behavior. And so a pediatric neuropsychologist uses that knowledge and understanding to help support students or children who have neurodevelopmental conditions, so anything that kind of started early on in life. That includes learning disabilities, it includes ADHD, it includes language disorders, it includes autism. And then, we also have that training and that expertise in understanding mood and anxiety. And that often relates and impacts academics and functioning early in development. And then there's also the impact that some medical conditions can have on one's ability to learn and kind of those cognitive abilities as well. So, my expertise really lies in the neurodevelopmental pieces. Again, as you said, the learning disabilities, language, ADHD, autism, and then you know, helping to support the anxiety and the mood that could come along with it or could impact those academic areas, and then really kind of supporting those families.
Wow. So it sounds like you really kind of have a busy day.
Yes.
So I guess how often do you see and diagnose students with dyslexia, and what does that look like? Because I know oftentimes parents that probably see you at that point are really looking for, like, my child is struggling, teachers are seeing things, maybe the school district isn't really acknowledging whatever those differences are, and they're looking for outside testing. I'm curious to see, like, how often do you see students that have reading differences and dyslexia?
I would say there's more times than not a question about reading, right? Dyslexia is just one concern or area in reading because there's reading comprehension as well. And so I would say that I see about 60%, 60% of my practice is questions around reading. That's not necessarily such a surprising number given that we know that 80% of individuals with learning disabilities, it ends up being, there's a dyslexia component to it. Um, and um, and I'm working with a kiddo right now that I'm worked with today, that there's a question, right? And I'm simultaneously writing a report where there was questions about language-based learning differences. So it's super, super common. And it really is such an important part of development and a student's life, because we learn to read and then we read to learn. And so it's often, if a child is struggling with reading or understanding what they read, it's going to start to bleed into all those other areas, and then their self-esteem as well. So social studies, math, word problems, science, every subject requires an element of reading and understanding what they read. So it's very often a question that parents are looking to understand.
So I see that someone asked a question about, dyslexia and the effects on math. And I know for sure, as you just said, I mean, really, as students get older, I think, what is it, after fourth grade, you're really reading to learn. So that's kind of where some teachers and parents might see more of the behavioral things kind of unfold. Do you?
And just to even answer the math piece too. So when we think of it, we of course think of math word problems, but there's after second grade, letter and number reversals actually are developmentally appropriate up until a certain age. So up until kind of second grade is when we start to think of it as being, that's not something that we would typically see afterwards. And so how that relates to math is number reversals as well. And, there's an element of that I'll see in math as well, and kind of transposing numbers and number reversals, not necessarily, and I often see that in the kiddos with dyslexia. There's so many things that go into math. You need to pay attention to the signs, right? You need to know your math facts. And also when we think about learning disabilities, having one in isolation is oftentimes an exception rather than the rule. There's all this overlap in neurodevelopment, in the underlying skills that are required to learn academic ability skills. And so it's not uncommon that they do tend to overlap. And even though we kind of break them apart into these individual pieces and sections, we take them apart and then we have to put it back together to kind of form that conceptualization of why there are these difficulties in alternative areas as well.
No, that makes complete sense. I mean, when I co-taught 8th grade math, they're really, my co-teacher would say, like, math is its own language. And so as you progress in your math career, there's vocabulary. You have to know there are many different ways to say subtraction and addition and different physical signs for multiplication and division and all of those things.
Absolutely.
That, it really can frustrate a child when they're like, well, you told me the X sign is multiplication. Now you're putting parentheses around it. Like, what do you mean?
So, I mean, math definitely loads heavier on visual skills, but there's such a strong language component. And also, it also depends on how math is taught. In some schools are very language heavy in how they teach math. And when there's underlying language concerns, then of course it translates into having difficulties in those math areas. And then we might want to think about those multisensory, forms of instruction.
Absolutely. And I know someone just commented on that.
Oh,
actually,
exactly.
So I want to switch my questions, actually, because my last question was really, what are 3 to 5 signs that you would maybe share with our audience for someone that would need to see someone like you?
Right. So it, of course, depends on the age. It depends on, which condition or disorder we're talking about. I would say that as parents are expert in their children. And so really, if they're noticing, when a child is learning in school that they're having difficulties picking up on the letter names, the letter sounds, and blending words together, and that is a laborious effort, then again, I would start to then question, is there something that's contributing to these difficulties? I would say in terms of, as I said, after second grade, this isn't kind of a key sign, but those letter reversals aren't as typical. A history of having language difficulties. Again, at risk factors don't correlate necessarily, aren't this one and the same of having a a disorder, but we often see individuals with articulation difficulties as
Mhm.
well, that language retrieval, so finding the right word to use in a situation, are often, you know, some subtle things that we see in kiddos with dyslexia. But at the same time, you know, dyslexia is a deficit in one's ability to read and decode and those phonological properties. So the individual sounds that make up words.
Mhm.
And if we're seeing that our child is struggling, then we
Right.
need to pay attention to it, and we can't address what we don't know.
Right.
And so the neuropsychological evaluation really will help to understand what are those underlying difficulties so that we can then best prepare. So I would say, kind of picking up on the fact that these skills are harder
Mhm.
and, you know, to learn, and it's a more laborious effort.
Okay.
I would say from the attention realm too, because you know, we think of ADHD as being a deficit in the ability to pay attention, but
Right.
really it's difficulties in regulating where one's attention is going.
I
So,
like that. That makes a lot of sense to me. Yes, definitely.
and and so that's kind of where, when I would love parents to kind of think about, okay, you know, I give them a video game and he and she is able to pay attention for hours and hours on end. I give them a homework assignment, or I give
30.
them something and they are, you know, in another planet, right? And it's not, I've never met a lazy student in my entire life. And so it's really about the effortful control of that attention, the effortful control that it takes to engage in an academic task.
Yeah.
And I would say in the writing realm, you know, because
Mhm.
again, I could give you a million signs, but that's not going to be helpful
I
right
love
now.
this.
And also, we have, I know that, you know, time, we don't have, I could go on for days and days and days. I mean,
No,
this is what
that's
I
great.
live and breathe. But I would say in the writing realm is for students that have difficulties. So there's expressive language, right, that we
Yes.
need for writing, that oftentimes leads into difficulties with, you know, language leads into difficulties with writing, but it's not always the case. When you see a large discrepancy in what one can write down and, in comparison to what they can orally express,
Mm.
that's also a big, kind of red flag to me,
Right.
and that
Right.
there's something else kind of going on that's making it difficult, for
Right.
them.
It's that like receptive and expressive language that
Hmm.
I try to explain to some parents or teachers, because I'm a learning specialist at my middle school.
Right.
And, you know, I try to explain that you could be giving directions and you think it's clear and maybe you're not chunking it. And then the students may perceive it a different way. So if you're not doing that check
Exactly.
in to say, like, did you understand? Or can you repeat back? Or what did you
Right.
interpret? They
That's
could really understand what you're saying, but maybe they can't get it out, or maybe they really didn't understand and then they're taking it somewhere
right.
else. So I,
I think we take for granted how difficult writing is, and it's
I
something that
know.
you have to learn. You're not just born with the
No.
ability, you know, same with reading, writing, math. You have to learn it, right? And in order to learn how to write, you have to understand what a question is asked, as you said, right? You have to
Right.
formulate an answer, you know the
Mm-hmm.
answer to that question. You have to then put those words together to formulate sentences in an organized way that someone else can read. And then there's that fine motor component as well,
Yeah.
that that comes along with all the other developmental concerns that we see. There's so much overlap. You know, there's not just one
Right.
region in the brain that kind of does all the, you know, there's so much overlap. And so, yeah, as you said, you know, breaking it down into that
Right.
individual, in those individual components, um, are so important.
Well, and I would think, just for our listeners watching, I'm really happy to hear you as a neuropsychologist is really preaching what I mentioned to teachers and families. Like, writing is not easy. And
No.
when you have a student or a child that they have a language based learning difference, you really have to like be savvy in ways that you can help them process and write. And, you know, nowadays all of us are on the computer typing, but
Mm-hmm.
still, that you still need to know how to keyboard, you know, like there's
Right.
still
Right.
a lot of things that are
Right.
involved in that. So I really appreciate you breaking that down, and I really think our audience does as well. um So I want to get to our last question, and I was really curious if you could share with our audience more about your practice. So is this your private practice? Do you connect with any of the schools in New York City to do testing for them, or is it just outside testing that's private? I'm really curious.
So I am a one person private practice. So
Okay.
I think it's, something that someone pointed out to me, which said, you should really tell people that that's something that you do, is I do all the testing myself. So that way, I am able to appreciate really the process that goes on with each individual task as well. Even though I am one person in private practice, one of my biggest concerns is, oh, I'm going to feel isolated. I'm not going to,
Right.
be collaborating with people. And really, I really don't view, now that my practice is open, because it is relatively new, I'm working all the time and collaborating all the time with teachers and schools, because really school, I want to learn what the curriculum looks like in a school too, so that I know what are the sports the child already has gotten. So then make the claims, and see the deficits that I see. And then so I'm always collaborating with teachers, learning specialists, therapists, speech language providers. I think, in my recent cases, I think I've collaborated with 4 or 5, other people in this report, which sounds like a lot of work, but I think right now, especially during these times, it's
Mm-hmm.
so important to get that qualitative, descriptive information of what they're seeing in the child's everyday life. And then something that I also find, and something I really value in evaluations too, because they are super time intensive, they can
Yeah.
get to be expensive, is there's a huge collaboration piece that I do with the parents as well.
Okay.
There's no kind of big reveal at the end. I
Okay.
really try and touch base with parents after each testing session and let them know kind of what I saw, what I didn't see. Have you seen this before? Is this
Right.
surprising to you?
Right.
And oftentimes parents will say, no, that's exactly what I see. No, I see that. And then it'll kind of glean more information and ask kind of more tailored questions to then help use the final feedback session as more of that discussion of, okay, so what's next? What are we going to do about this?
Right.
Um, and then in terms of working with the schools directly, I am contracted to work and see evaluations and accept valuations from the Department of Education.
Okay.
And so in those cases, for whatever reason it may be, the DOE or Department of Education is not able to perform the evaluation that is requested of the parent, or
Mm-hmm.
they did and the parent isn't super satisfied with that evaluation. So then the DOE will then agree to pay for the evaluation for the child.
Wow, it definitely sounds like you are busy, but in a sense that I like the collaboration piece, because myself as a learning specialist, there are updates that need to happen or students that need to be tested. And so I do get the phone calls or the emails, and they say, I know teachers are doing a lot, but it would really be helpful to have, that assessment from the virtual classroom setting, or if they're
Right.
hybrid, whatever it is. And I recognize that, times are different, and you all need to, you still need to collect data as close to the way that you used to do it before the
Right.
pandemic.
Right.
So
Right.
no, that's
No,
exciting.
and I want to say that teachers, it's not like they're waiting around for extra things to do, and I not at all. So I feel so bad that I'm saying, can I just borrow 20 more minutes of your time? I
Right.
know you maybe completed this questionnaire, and it really is with the, appreciation of the value add they have in these evaluations, because they really are the ones that are seeing the student day in and day out,
Right.
and that information is so important, and even if they just have such great insight,
Right.
clinical insight, that they may not know what it's called, right? But when I ask certain questions and pull
They're
for
like,
certain
oh,
information,
yeah.
they give me certain information that I'm like, that's exactly what I was asking for,
Right.
and it's a matter of kind of also knowing which questions to ask so that
Right.
you can get the information that's important.
No, that makes sense. Well, Dr. Katz, I'm so excited that we could do this brief 20-minute kind of like informing our audience, because that's really my sole purpose of this account, and just putting out information that kind of what you said, teachers and parents probably have a feeling of what's going on, but they don't really either know who to turn to,
Right.
they don't really know what's happening. So I am very grateful for you to find this time to collaborate with me. And I really hope we can do something in the future, maybe another live.
Absolutely,
Yes,
absolutely. And I will also say too that sometimes when there's an evaluation, there gets to be this emphasis of the things that are not going right. And I think it's so important to balance that with all the amazing strengths that every child has. And there always
absolutely.
are strengths. There are always,
Absolutely.
things that the child is able to do and that will make the child tick. And so kind of teachers are and parents know what they see what that is in the classroom as well, and I then will try and integrate that into the evaluation itself so that I can make it work,
Right.
and kind of so I loved speaking with you. This is great, and so yeah, I hope that we can continue to do something like this in the future.
Absolutely. Well, thank you so much for your time. And thank you
Thanks.
everyone for joining in. And be sure to save the video and share with anyone that you think would find this helpful. All right. Bye.
Bye.